Okay, this is my intradermal skills. So the first thing I'm going to do is I'm going to apply hand sanitizer. I'm going to make sure that I have the right patient, the right time of day that the medication is supposed to be administered, the right site, which is the inner side of the forearm, the right time, and the correct dosage. So we have a 0.9% sodium chloride that we will be using. We'll be using 0.1 milliliters of that. So what we're going to do first is I'm going to open up an alcohol wipe. I'm going to clean the top of the vial for 5 to 10 seconds. Alright, and while that's drying, I'm going to go ahead and open up my needle. And we're gonna draw up 0.1 milliliters of air. Move the cap, insert it into the vial to equalize pressure. And then we're going to draw 0.1 milliliters. Okay. And here we have 0.1 milliliters with no air bubbles. I'm going to go ahead and cap that flat. And if I was preparing this outside of the patient's room, then I would have to label it, but I did it inside the patient's room, so that's good to go. Next thing I'm going to do is I'm going to open up another alcohol swab. I'm going to clean the patient's skin. And we're going to let that dry. And while that's drying, I would apply hand sanitizer and put on gloves, but I am now out of gloves. So I have my gloves on. And what I'm going to do is I'm going to remove the needle cap. And I'm going to make sure it's bevel up. I'm going to pull the skin taut. So we're going to pull it apart. I'm going to pull it straight out. And then I would put the safety on the needle and put it into the sharps container. Next, I would remove my gloves, put on hand sanitizer, and then I would document.